Sometimes words simply disappear. In the silence that follows, something still communicates, delicately, subtly, yet profoundly powerfully. It's the body that speaks, and especially at the end of life, this silent language becomes the primary way to express emotions, needs, and even farewells. If you're here, chances are you're living with or caring for someone who is going through this incredibly sensitive stage. It might be a beloved family member, a patient, or someone you're closely supporting as a caregiver or healthcare professional. And if you've already noticed that, in this phase, words become increasingly rare, know that this is natural. What few people realize is that when speech fades, the body begins to tell its own story. Small gestures, barely noticeable movements, changes in breathing, facial expressions, and even the touch of a hand take on much deeper meaning. This video is an invitation for you to learn how to listen to that silent language. Understanding the body language of an elderly person nearing the end of life isn't just a technical skill. Above all, it's a gesture of love, respect, and presence. Throughout this content, you'll discover how to observe these signals, how to interpret them accurately, and most importantly, how to respond to them with warmth, offering comfort, security, and dignity. Because in the end, more than any words, what truly makes a difference is knowing that no one has to go through this moment alone. Why observe body language at the end of life? When verbal communication starts to become limited, whether due to extreme weakness, disease progression, or simply the natural process of the body shutting down, the way a person expresses themselves changes. And this is exactly when body language takes on a vital role. Observing these signals isn't just a matter of curiosity or technical skill. Above all, it's a way to offer real, present, and deeply human care. Because often, the elderly person at this stage can no longer clearly say whether they're cold, thirsty, uncomfortable, in pain, or feeling anxious. But the body communicates, and those who know how to look know how to respond with care. Ignoring these signals can lead to silent suffering, unnoticed physical discomfort, unspoken anxiety, or even pain that could be relieved if correctly identified. On the other hand, those who learn to observe come to realize that small gestures, adjusting a pillow, holding a hand, moistening the lips, or simply being silently present can make a profound difference. In addition, interpreting body language accurately also helps distinguish what is part of the natural dying process, such as changes in breathing or skin color, from what may indicate discomfort or suffering that requires immediate attention. The greatest benefit of this attentive approach is clear. It transforms uncertainty into confidence, fear into presence, and helplessness into care. It's a path of transformation, not only for the one who is leaving, but also for those who remain. Because at this moment, offering comfort doesn't require perfect words. It requires presence, attentiveness, and sensitivity. And that is exactly what we'll begin learning now: how to recognize, understand, and respond to the silent signals the body communicates. Most common body signals: understanding what's natural. Not all silence is absence. As the body begins to slow down, it starts expressing itself in different ways, and every detail can carry meaning. Observing these signals isn't about looking for signs of death, but rather recognizing clues about the emotional and physical state of someone approaching the end. This chapter is a guide to help you see with greater sensitivity what often goes unnoticed by hurried eyes. Posture and muscle tone. One of the first noticeable changes is in posture. The body starts to withdraw, not out of fear, but to conserve energy. Shoulders slump, the head rests more easily, legs stay bent or semi-extended, and the torso may curve or sink slightly into the bed. This curling in is a natural reflection of the progressive loss of muscle strength and tissue relaxation. Muscle tone decreases, and the body yields. This doesn't necessarily mean pain. It's simply a sign that the body is redirecting its remaining energy. Observing posture helps identify discomfort. Is the head positioned comfortably? Are joints properly supported? Small adjustments, like placing a pillow between the knees or under the arms, can prevent silent pain and immediately improve comfort. It's in this level of detail that care is transformed. It's not just about seeing the body, but about listening to it. Facial expression. The face is a faithful mirror of both emotions and physical sensations. Even when an elder is too weak to communicate, facial expression remains a very expressive channel. Signs of discomfort often show up as subtle tensions: a furrowed brow, knitted eyebrows, squinting eyes, a clenched jaw, or tightly pressed lips. These signals are especially important because, in many cases, pain is not verbalized, but it is still felt. On the other hand, moments of peace can also be perceived. The face softens, muscles release, the eyes remain gently open or lightly closed, and the lips rest slightly parted. This relaxation can indicate an absence of pain or even a deeper acceptance of the dying process. Facial expressions should be observed continuously. Sudden changes or recurring expressions may offer important clues about the need for adjustments, whether in medication, body position, or even the surrounding environment. Learning to recognize these subtleties is a way to ensure dignity and peace during this deeply sensitive time. Movement and restlessness. The body doesn't always remain still. At certain stages, it's common for the elderly to show repetitive movements or even restlessness, which can often confuse or alarm family members. Hands pulling at sheets, legs moving without clear direction, arms raising involuntarily, or attempts to get out of bed may all be expressions of physical or emotional discomfort. They may also be neurological reflexes, especially in patients with advanced illness. It's important to observe the pattern of these movements. Do they appear suddenly? Are they accompanied by facial expressions of pain or sounds like moaning? Or do they seem more automatic, as if part of an involuntary cycle? Mild, repetitive movements aren't always signs of suffering, but persistent and disorganized restlessness deserves attention. In such cases, it's essential to seek professional help to assess possible causes, from pain, fever, or infection to basic sensations like thirst or heat. The key is in not interpreting all movement as crisis, but also not ignoring what may be an urgent call for relief. Breathing. Breathing may be one of the most visually striking signs at the end of life, and for that reason, it's also one of the greatest sources of anxiety for those who witness it without understanding what's happening. As the body begins to shut down, breathing patterns change. One common type is called Cheney-Stokes respiration, marked by periods of deep, rapid breathing followed by longer pauses, apneas. This pattern can be frightening, but it's often natural and doesn't necessarily mean the person is suffering. Other variations include irregular breathing, spaced out sighs, or very shallow breathing. The chest and abdominal muscles gradually lose strength, and the brain's respiratory control also changes. It's crucial to observe whether these changes are accompanied by facial expressions of pain, restlessness, or loud noises. If not, they are usually just part of the body's physiological decline. A calm environment, low light, comfortable temperature helps promote peaceful breathing. Sitting nearby, speaking gently, or simply placing a hand on the shoulder can provide more peace than any medication. Understanding these patterns helps reduce fear and offer a more serene presence, which is exactly what the person needs most at this time. Hands, extremities, and skin. Hands speak. Even without strength or steadiness, they continue to seek connection. Often, a dying person may try to hold on to something: a sheet, the edge of the bed, someone's hand. This gesture usually reflects a need for safety, for presence. The extremities also show visible changes. Skin may become cooler, bluish, or pale, especially on the hands and feet. These changes indicate decreased peripheral circulation, which is expected in this stage. Touch, human warmth, and light blankets can help provide comfort. More important than warming is sensing what the body is asking for. Could those hands be silently saying, "Stay with me"? Observing skin tone, texture, and even the presence of sweat or dryness can also provide insight into the elder's physical condition and comfort level. Nonverbal sounds. Even when speech is no longer possible, the body continues to make sounds, moans, sighs, murmurs, or audible breathing. These sounds should not be ignored. They are clear signs that something is being communicated. They don't always indicate pain. Moans can result from the effort of breathing, body positioning, or even involuntary reflexes. But if they are intense, persistent, or accompanied by tense expressions and restlessness, they may be signaling real discomfort. Pay attention to the frequency, tone, and timing of these sounds. A deep sigh after a gentle touch might signal relief. A continuous moan while repositioning the body might indicate pain. Once again, it's the combination of signals, sound, expression, posture that tells the story. And those who listen with an attentive heart can translate these sounds into meaningful care. How to respond to body signals. Comfort and presence. Knowing how to observe is only half the journey. The other half, perhaps the most important, is knowing how to respond to those signals. And this doesn't just mean technical interventions, but something much deeper. The ability to offer comfort, presence, and dignity, even when words no longer have a place. When the body speaks through a pained expression, a heavy sigh, or a restless movement, the first question we should ask isn't, "What should I do?" but rather, "What does this mean?" And often, the answers lie in the simplest of gestures, the power of touch. A steady, gentle, and intentional touch can communicate messages that no words can reach. Holding a hand, caressing the forehead, or simply placing your palm on a shoulder conveys something essential. You are not alone. It soothes, slows the breath, and can even reduce visible signs of discomfort. Simple physical adjustments, repositioning the body, better supporting the limbs, relieving pressure points, adjusting pillows, or smoothing out creases in the sheets. These actions have a huge impact. A tense expression or quiet moan often fades away simply with a small change in position. Caring for the environment. Soft lighting, reduced noise, a comfortable temperature, and familiar scents, like a favorite perfume, a calming essential oil, or even the smell of a beloved item, help create an emotionally comforting space. The body responds to its surroundings, and a warm, welcoming environment fosters greater serenity. Emotional responses. Silence, when filled with presence, is deeply powerful. Speaking little, but gently and lovingly, makes a difference, even if the person can no longer reply. Saying things like, "I'm here with you," "You're safe," or softly describing what you're doing, "I'm going to fix your pillow, okay?" helps maintain connection and communicates reassurance. Technical interventions when needed. Not all discomfort can be eased with affection and physical care alone. That's why having the support of trained professionals, doctors, nurses, and palliative care teams is essential. They can evaluate whether adjustments in medication are needed for pain, anxiety, shortness of breath, or other forms of distress. In the end, responding to body signals is, above all, an act of listening, a kind of listening that doesn't depend on ears, but on eyes, hands, and heart. Because now, more than ever, the body speaks, and those who learn to listen also learn to love more fully. What is not a sign of suffering? Understanding the differences. It's very common for family members, and even some healthcare professionals, especially those less familiar with end-of-life care, to interpret certain natural signs of the body as suffering. This confusion can lead to anxiety, fear, and sometimes unnecessary interventions, or even increase the distress of those witnessing the process. That's why it's so important to learn how to distinguish between the natural changes of the body as it begins to shut down and the signs that truly indicate discomfort or pain. For example, irregular breathing patterns, long pauses, gurgling sounds, or gentle rattling noises are, in most cases, not signs of pain. They are the body's way of slowly letting go, including the systems responsible for swallowing and managing the airways. Similarly, cold hands, purplish skin on the extremities, a distant gaze, or even a lack of verbal response are common manifestations of reduced circulation and energy, not indicators of suffering, but rather signs that the body is completing its natural life cycle. Knowing this completely changes the experience for those who are present. It brings relief, reduces feelings of helplessness, and allows the focus to remain on what truly matters, offering comfort, affection, safety, and presence, without unnecessary interventions or avoidable distress. When we understand that not every silence is pain, and not every physical change is suffering, we can be more present, with greater calm, deeper love, and less fear, when it's time to seek professional help. While many signs are part of the natural process at the end of life, there are situations that do require the intervention of trained professionals. Recognizing these moments not only prevents unnecessary suffering, but also brings greater peace of mind to those providing care. Persistent signs of discomfort, such as facial expressions of pain, continuous moaning, restlessness that doesn't improve with simple adjustments, or repeated agitated movements, are clear indicators that something needs to be clinically assessed. It could be physical pain, shortness of breath, intense anxiety, or other sources of discomfort that can and should be relieved. Sudden changes in general condition, like high fever, very labored or distressed breathing, acute swelling, or sudden extreme paleness, also fall outside the expected. Another critical moment is when family members or caregivers realize they're emotionally overwhelmed. Emotional overload is real and absolutely valid. Having professionals nearby, whether medical staff, nurses, psychologists, or members of the palliative care team, is not a sign of weakness, but rather of love, responsibility, and care for both the person who is leaving and those who remain. Seeking help doesn't mean over-medicalizing the moment. It means ensuring it can be experienced with as much comfort, dignity, and peace as possible. Because in the end, professional care and loving care go hand in hand. The importance of presence. More than caring, it's accompanying. When verbal communication is no longer possible and the body speaks through subtle gestures, presence becomes the most valuable form of care. Being there, fully, attentively, quietly, without necessarily saying anything, is often all the person at the end of life truly needs. Presence doesn't mean doing all the time. It means being, sharing space and silence. It's the kind of care that can't be measured by technique, but by human connection. Holding a hand, gently touching the face, adjusting a sheet, playing a favorite song, creating a peaceful environment. All of these small acts communicate something essential. I am here with you. This kind of presence goes beyond relieving physical discomfort. It eases anxiety, offers reassurance, and brings a sense of peace. And often, even without words, the person senses it, reacts, becomes calmer. Sometimes the most profound communication between the one who is leaving and the one who remains happens in silence. More than caregiving, accompanying is a deep act of love. It is being present, not to stop the inevitable, but to ensure that it unfolds in a dignified, human, and loving way. Because in the end, it's not the words that linger, it's the memory of the gaze, the touch, the loving presence that carried that moment, and that, for those who stay behind, can become one of the most powerful ways to move through grief with greater peace. The body speaks, and those who listen offer love. Throughout this video, we've walked together on a journey of listening. Not a listening made of words, but of attentive eyes, gentle touch, and deep understanding of what the body communicates when life approaches its end. We've learned that the body speaks in subtle, silent, symbolic ways. It speaks through a shifting breath, a gaze that drifts farther away, gestures that, though fewer, carry profound meaning. And when we learn to read this language, we become more than caregivers or family. We become true companions on the journey. Understanding these signs doesn't mean preventing the goodbye, but ensuring it happens in the most dignified, loving, and peaceful way possible. It's about transforming a moment often filled with fear and uncertainty into a space of care, presence, and above all, love. If there's one message to hold on to, it's this. Communication is never lost. It simply changes form. And those who learn to listen to the body also learn to listen to life, right up to its final breath. Being present, offering comfort, recognizing the signs, and responding with tenderness doesn't change the outcome, but it transforms the entire experience for both the one who is leaving and the one who remains. And that is perhaps one of the purest expressions of human love.